Welcome everyone. Today we have our student Dr. Mohana Parthiban, who's from Malaysia, and she matched in family medicine this season. So we wanted to get together with her and get her perspective on the challenges she faced as an IMG visa seeking IMG matching in family medicine. So welcome Mohana. Glad to have you.
Hi, Dr. Kira. First of all, thank you so much for this opportunity. I'm sure all the videos that you make are helping someone out there in the USMLE journey.
Yes, so that's the intent, hopefully to motivate other IMGs. So thank you again. Now let's start with some background information about you, your med school and your entire journey of USMLE.
Sure, I'd love to introduce myself. So, I'm Dr. Mohana Parthiban. I recently matched into family medicine residency program. I am an international medical graduate. I studied basically my medical school was a bit unique because the first half was in India and the second half my clinicals was back in Malaysia. I graduated around in 2018, and I'm also a visa seeking applicant.
So talk to us about the journey, your interest in primary care, and then how you applied in this season and some of the challenges that you may have faced.
Yeah, definitely. So this season specifically was a very challenging one, as we know, because COVID hit pretty bad in all the countries, and all my travel plans were actually cancelled. So that was one of the biggest challenge as well. And apart from that, I also had to work on my profile because my step one score was a bit on the lower side. And for that aspect, I had to work on other aspects in the if it come for volunteer work or maybe a clinical rotation and also maybe some research. So this is where I had to work on. And apart from that, I feel like my USMLE journey was pretty amazing. And also I had USMLEsarthi to help me out throughout the journey. So I'm extremely thankful for them because being an applicant in Malaysia, it's not very common for us to pursue the USMLE journey, and I didn't have a mentor or any senior who could guide me of all the little aspects in the journey, as well as looking at the circumstance in the pandemic. I wanted to be confident in applying and make sure my application was perfect. So this is where USMLEsarthi came in.
So let's talk about how you developed your interest in primary care. So how did all that happen? How many electives and which year? And I guess this past season you could only do tele rotations because of the pandemic. So talk a bit about how you developed your profile in primary care.
Right. So I've always been interested in primary care because I feel that's the aspect where I can see all aspects of patient, from the geriatric to the pediatric patient. And I didn't have a specific interest in terms of population and also would say in a specialty. So I decided to pursue primary care medicine and also family medicine. So this is where I try to do as much of rotations possible. In the thing about primary care is you're not bound to only family medicine. There's also internal medicine primary care out there. So your rotations can be various field. You can be even in internal medicine, and you can even be in primary family medicine. So I had a couple of internal medicine rotations, which I did before the pandemic. So it was a hands-on rotation. And once the pandemic hit, I switched entirely to telerotation, and I'm extremely thankful because USMLE Sarthi actually connected me to doctors who offered these rotations. There, I did a primary care family medicine rotation, and I also did a primary care. I worked as a volunteer back home in Malaysia at a community clinic. So I think all this helped strengthen my application for primary care. But the most important thing I would say is make sure your letters of recommendation is specific to the specialty that you're applying to. Even though you have a different rotation in different fields, make sure the letter writers are writing down that you're interested in family medicine or any specialty that you like.
Okay. Uh, Also, talk about in the past season because you were in Malaysia, you were working there. So, how valuable was the home country experience as you were interviewing or making your IRAS CV? How valuable was that? Do you feel?
So it was definitely valuable because I was working during the pandemic. And as we know, a lot of doctors who are working during the pandemic gain a lot of different kind of experience. And this was one of the questions that I got during my interview, like how was Malaysia taking the COVID-19 pandemic, and what are they doing in regards of the doctors and what is happening there. So I was able to talk about my experience working in a community clinic and me being a frontliner screening patients and also trying to uh, treat them symptomatically. So all this helped out during my interview as well. And they were really appreciative of doctors who are working during application processing and also during the entire match process, especially during COVID. So this was helpful.
Okay. Um, so for applicants who are going to go in the match in this season and maybe even the next season, and we still are in a kind of a pandemic, what are your top recommendations? I think one of the things I heard was specialty specific LORs, right? So that what else can applicants focus on, whether they are in their home country or they are in the US, especially when it comes to family medicine? So, what would be the top things you would recommend they do?
Right, thank you for this. I mean, this is a very good question that you asked. So, for family medicine specifically, I would suggest try to volunteer in primary care clinics because that itself speaks for your experience. And primary care doesn't really have to be very specialty specific. So, if you work in a primary care, you can talk about all the experiences that you've had during the interview as well. Apart from the letter of recommendation, yeah, there are a couple of tips that I would like to give. If you are an international medical graduate, I would advise try to get as much as clinical experience as you can. And letters of recommendation from US doctors way more than your home country letters. So try to get tele rotations. I'm not sure how the situation is currently. It might get better, so it might change into a in-person interview, but right now, I would recommend you to take up some tele rotation so that there is continuous experience in your CV. And also try to work on your personal statement and also try to get someone to proofread your entire application. Maybe an agency or like USMLEsarthi or someone, as maybe an individual journalist to make sure your entire application is perfect before you submit it.
Okay. So, focus on USC, whether tele or on site, and of course, IRAS CV and NPS. So let's talk about interview preparation. How did you go about it? Of course, you were our student, and how did the Sarthi team help you in identifying some of your strengths and improvement areas when it comes to interviewing?
Yes, for this, I have to especially thank my mentor in USMLEsarthi, Dr. Chintab Shah. He was extremely helpful. He was always there whenever I had any doubts and questions. And we had an one-on-one interview, and he gave me a very detailed feedback. The most important thing in interview prep is, as we know, practice makes perfect, but you need a person to give you constructive criticism. Someone who can tell you what is right, what is wrong, someone who's experienced and has gone through the entire match process. So this is very valuable. And for that, my mentor and all the panelists in USMLEsarthi was very helpful. So they were always there for us, and also it helped because I had a huge group of all the applicants, uh, which were in a Telegram group done by USMLEsarthi. This helped my anxiety and all the small things that I was having doubts about. So apart from that, I would say for interview process, since it was all virtual, there are a lot of things that you should consider, like lighting, your background, and what kind of computer you use. These are the things that you might have missed or you never thought about. But when you have someone guiding you and someone who can give you constructive feedback, that's when you start to realize these tiny details makes a lot of difference.
Okay. One thing I wanted to come back, and I wasn't sure of that. Uh, do you think research was important part of your application? Did it come up in the interviews?
So I had two publications. One was done during my medical school. It was a poster presentation, and the other was a journal review. So for me personally, no one asked me about my publication because I was a pretty recent grad. So
Okay.
2018 is still considered a recent grad if
Right.
it's less than 3 years. But if you're older, I would definitely suggest you take step three and also concentrate more on research. I've had friends who went through this match process, and one of their interviews entirely was about their research. And
Wow.
especially if it picks up their interest, if it was in the field that you're applying to, that would be definitely a very good conversation starter.
Okay. So yeah, if you're an old grad, then maybe research and step three will add to your application. Okay. All right. This was very, very helpful, Mohana. Any last minute tips, anything that we missed for the students?
Well, that's the last minute advice. I mean, every journey is different. So I would just advise don't compare yourself. Even if you have low score or any red flags on your CV, you can match. So just keep a positive heart and keep going.
Well, thank you very much and best wishes for your upcoming residency.
Thank you. Thank you.